In recent years, trauma therapy has undergone a significant transformation. Eye movement desensitization and reprocessing, or EMDR, has emerged as a groundbreaking approach. This innovative method is revolutionizing the way we understand and treat trauma, offering new hope for those affected by PTSD and other trauma-related conditions. EMDR delves into the roots of trauma, providing a paradigm shift in treatment. Developed by Dr. Francine Shapiro in 1989, it's now an evidence-based treatment for PTSD, endorsed globally. This chapter explores EMDR's history, mechanisms, and applications. Join us on this journey into the world of EMDR, where science and compassion intersect to alleviate suffering. Trauma, in its various forms, has the potential to leave an indelible mark on the human psyche. Whether it stems from a single catastrophic event or chronic exposure to adverse experiences, trauma can shatter our sense of safety, disrupt our emotional equilibrium, and cast a long shadow over our lives. The impact of trauma extends far beyond the initial event, often manifesting in a constellation of psychological, emotional, and physiological symptoms. Post-traumatic stress disorder, or PTSD, a common consequence of trauma, is characterized by intrusive memories, nightmares, flashbacks, hypervigilance, emotional numbness, and difficulty experiencing joy or pleasure. These symptoms can significantly impair an individual's ability to function in daily life, affecting relationships, work, and overall well-being. Understanding the profound and pervasive impact of trauma is paramount in appreciating the need for effective treatment modalities like EMDR. The journey of eye movement, desensitization, and reprocessing, or EMDR, began in 1987 with Dr. Francine Shapiro. She noticed her distressing thoughts diminished as her eyes moved back and forth. Intrigued, she explored the connection between eye movements and emotional processing. Her research focused on anxiety and traumatic memories. She developed a protocol involving eye movements and recalling disturbing events. Participants reported significant reductions in emotional distress. EMDR was formalized as a distinct therapeutic approach. Rigorous trials confirmed its efficacy, especially for PTSD. Today, EMDR is a testament to scientific inquiry and clinical observation. EMDR's journey from a novel concept to a well-established therapeutic approach is best illustrated by its widespread endorsement from leading mental health organizations worldwide. The American Psychiatric Association recognizes EMDR as a first-line treatment for PTSD. Substantial empirical evidence supports EMDR's efficacy in reducing PTSD symptoms. The World Health Organization also recommends EMDR for trauma-related disorders. The WHO's endorsement highlights EMDR's cross-cultural applicability. Numerous respected institutions recognize EMDR as an evidence-based treatment modality. EMDR's place in modern psychotherapy is solidified by its ability to provide lasting relief from trauma's grip. The neuroscience of trauma. A look inside the brain. Trauma leaves an indelible mark on the brain, disrupting its delicate balance. The amygdala becomes hypersensitive, leading to hypervigilance and anxiety. It's like a smoke detector stuck in alarm mode. The hippocampus struggles to integrate traumatic memories, causing flashbacks. The prefrontal cortex's ability to regulate emotions and rational thought is compromised. Trauma throws the brain's activity into disarray, leaving individuals feeling overwhelmed. EMDR and neuroplasticity. Rewiring the brain for healing. The brain's capacity for change and healing is known as neuroplasticity. EMDR facilitates the reprocessing of traumatic memories, restoring well-being. Bilateral stimulation is crucial in this process. It activates both hemispheres, fostering calm, focused attention. The brain reprocesses the traumatic memory, linking it to adaptive information. The brain begins to heal, rewiring itself for resilience and growth. Building the foundation, preparation, and assessment. EMDR therapy is a carefully choreographed dance between therapist and client, guided by a structured 8-phase protocol. The initial phases, history taking and preparation, lay the groundwork for the transformative work to come. During history taking, the therapist delves into the client's narrative, gathering information about their traumatic experiences. The preparation phase focuses on equipping the client with skills to navigate trauma processing safely. This often involves teaching grounding techniques, such as diaphragmatic breathing and mindfulness exercises. The therapist also educates the client about the nature of trauma and the EMDR process. Section 2. Processing the trauma, desensitization, and installation. The heart of EMDR therapy involves desensitization and installation phases. Here, clients confront traumatic memories while engaging in bilateral stimulation. During desensitization, clients focus on the target network with bilateral stimulation. This could involve tracking the therapist's fingers or listening to alternating tones. Bilateral stimulation engages both brain hemispheres, promoting integration. This allows for adaptive processing of the traumatic experience. Section 3. Integration and beyond body scan, closure, and reevaluation. As the client processes the traumatic memory, they may experience a range of thoughts, emotions, and sensations. The therapist guides the client with gentle curiosity and unwavering support. The goal is to reduce the memory's emotional charge and its grip on the present. The vividness of the image fades, and negative beliefs lose their potency. The therapist then guides the client towards installation, focusing on strengthening the positive. The client identifies a positive belief to associate with the original memory. The therapist facilitates the installation of this positive cognition, strengthening its impact on the client's sense of self. Section 1. EMDR's versatility. Addressing a spectrum of trauma. Initially developed for PTSD, EMDR's reach extends far beyond this single diagnosis. Its principles offer healing for a wide range of trauma-related challenges. EMDR is effective for single-event traumas and complex PTSD. Complex PTSD often arises from chronic trauma like childhood abuse or war. EMDR helps process traumatic memories, fostering adaptive neural pathways. Integrated with attachment-based therapies, EMDR addresses relational traumas. EMDR paves the way for profound healing and transformation in relationships. Section 2. Tailoring treatment. Adaptations for complex presentations. EMDR's adaptability shines through in addressing dissociative disorders, often misunderstood and underserved. Dissociation involves a disconnection from thoughts, feelings, memories, or one's sense of self. EMDR therapists focus on stabilization and resource building before trauma processing. They prioritize client safety and grounding throughout the therapeutic journey. In addiction treatment, EMDR addresses the trauma driving addictive behaviors. By processing traumatic memories, individuals can heal and achieve lasting recovery. Synergy in healing. EMDR, in concert with other therapies. EMDR isn't intended to exist in isolation within the therapist's toolkit. Its efficacy is often amplified when interwoven with other therapeutic modalities. This integrative approach addresses the emotional, cognitive, and behavioral aspects of healing. One of the most harmonious partnerships EMDR forms is with cognitive behavioral therapy, or CBT. CBT helps clients recognize and challenge negative automatic thoughts. This cognitive restructuring solidifies the positive cognitions installed during EMDR. Section 2, a tailored approach. Selecting the right blend of modalities. EMDR and dialectical behavior therapy, or DBT, are powerful for emotional regulation and interpersonal challenges. DBT provides skills for mindfulness, distress tolerance, and emotion regulation. When integrated with EMDR, DBT skills support trauma processing. Clients build emotional resilience and coping strategies. This makes EMDR smoother and more manageable. DBT skills help integrate EMDR insights into daily life. Illuminating the path to healing. Neuroimaging and EMDR. EMDR's efficacy was supported by clinical observations and self-reported symptom reduction. Neuroimaging allows us to peer into the brain, illuminating trauma, healing, and transformation. fMRI, a powerful neuroimaging technique, measures brain activity by detecting changes in blood flow. This provides a real-time window into the brain's response to stimuli, thoughts, and emotions. fMRI studies support EMDR's impact on key brain regions implicated in trauma. EMDR treatment can lead to a decrease in amygdala activity, reducing hypervigilance and anxiety. Beyond the surface. Epigenetics and the future of trauma treatment. Epigenetics explores how trauma influences gene expression without altering DNA. Imagine our DNA as a library and genes as books. Epigenetic mechanisms act like librarians. Trauma impacts these librarians, altering gene accessibility. EMDR may reverse trauma's epigenetic impact, reprogramming genes, navigating the ethical landscape of EMDR practice. As EMDR gains recognition, upholding ethical standards is paramount. Informed consent is crucial. Clients need clear, comprehensive information. Ethical practice also requires therapist competence. Specialized training and ongoing development are essential. Practitioners must engage in supervision and continuing education. Ethical EMDR practice extends beyond individual client interactions and encompasses a broader commitment to cultural sensitivity and responsiveness. Trauma is not experienced in a vacuum. It is inevitably shaped by an individual's cultural background, beliefs, values, and worldview. Therapists must cultivate cultural humility, recognizing that their own cultural lens may differ from their clients, and that these differences can influence the therapeutic process. This involves actively seeking to understand their clients' cultural backgrounds, beliefs about mental health, and experiences of trauma through a culturally sensitive lens. Cultural sensitivity in EMDR also involves adapting the therapy to align with clients' cultural values and practices. For instance, some cultures may have specific rituals or healing practices that can be incorporated into the EMDR process to enhance its relevance and effectiveness. Therapists must be mindful of potential cultural interpretations of eye movements or bilateral stimulation and be prepared to adapt their approach accordingly. By honoring clients' cultural backgrounds and integrating cultural elements into the EMDR process, therapists foster a therapeutic alliance built on respect, understanding, and shared humanity. The transformative potential of EMDR is best articulated by experts dedicated to understanding trauma and healing. Renowned clinicians and researchers offer compelling insights into EMDR's unique power and efficacy. Dr. Laura Parnell emphasizes EMDR's holistic nature, healing at somatic, emotional, and cognitive levels. It's a holistic approach that respects trauma's complexity. Dr. Bessel van der Kolk states, EMDR allows patients to process trauma without re-traumatization. EMDR's focus on bilateral stimulation and somatic awareness helps integrate and release embodied memories. As EMDR solidifies its position in trauma therapy, the field buzzes with innovation, driven by a commitment to extend its reach. Researchers and clinicians explore new frontiers, enhancing EMDR's efficacy and applications. One promising avenue is EMDR combined with neurofeedback, harnessing brain plasticity for self-regulation. Neurofeedback measures brainwave activity in real time, providing feedback to the client. This helps individuals modify brainwave patterns, much like controlling breathing or heart rate. Combining EMDR with neurofeedback aims to optimize treatment outcomes. Another development is group EMDR protocols, expanding access to this therapy in community settings. Traditional EMDR is individual, posing barriers. Group protocols offer a cost-effective alternative, addressing collective trauma from disasters, war, or terrorism. Eye movement desensitization and reprocessing, or EMDR, stands as a testament to the power of human ingenuity and healing. From its beginnings to its status as a leading treatment for trauma, EMDR has revolutionized our understanding of recovery. The 8-phase protocol guides both therapist and client through trauma recovery, addressing a wide range of experiences. EMDR rewires neural pathways, integrating traumatic memories into a resilient sense of self. Neuroimaging and epigenetics reveal the profound shifts that occur through EMDR. EMDR's reach extends into integrative therapy, cultural sensitivity, and ethical practice. As we look to the future, EMDR promises to expand access and enhance efficacy. EMDR is a beacon of hope, a testament to resilience, and a reminder that healing is always possible.